In healthcare, self-care is any necessary human regulatory function which is under individual control, deliberate and self-initiated. Some place self-care on a continuum with healthcare providers at the opposite end to self-care. In modern medicine, preventive medicine aligns most closely with self-care. A lack of adherence to medical advice and the onset of a mental disorder can make self-care difficult. Self-care is seen as a partial solution to the global rise in healthcare costs placed on governments. The notion that self-care is a fundamental pillar of health and social care means it is an essential component of a modern healthcare system governed by bureaucracy and legislation. Self-care is considered a primary form of care for patients with chronic conditions who make many day-to-day decisions, or self-manage, their illness. Self-management is critical and self-management education complements traditional patient education in primary care to support patients to live the best possible quality of life with their chronic condition. Self-care is learned, purposeful and continuous. In philosophy, self-care refers to the care and cultivation of self in a comprehensive sense, focusing in particular on the soul and the knowledge of self. Universal requisites. There are a number of self-care requisites applicable to all humans across all ages and necessary to fundamental human needs. For example, as humans we need to intake sufficient air, water and food. Care also needs to be taken with the process of elimination and excrement. There must be a balance between rest and activity as well as between solitude and social activities. The prevention and avoidance of human hazards and participation in social groups are also requisites. Maturity requires the autonomous performance of self-care duties. Health maintenance. Self-care includes all health decisions people make for themselves and their families to ensure they are physically and mentally fit. Self-care includes exercising to maintain physical fitness and promote good mental health, as well as eating well, practicing good hygiene and avoiding health hazards such as smoking and drinking to prevent ill health. The personal responsibility for self-care in the context of preventative medicine was examined with a representative sample of the general public in a Citizens unregistered trademark jury, with the title, My Health whose responsibility. A jury disdains unregistered trademark. The benefits of living a healthy lifestyle were analyzed in the Carefully Heart Disease Study. Evidence showed a risk reduction in chronic diseases to be significantly associated with healthy lifestyles. Self-care is also taking care of minor ailments, long-term conditions, or only unregistered trademark's own health after discharge from secondary and tertiary health care. For instances of neck pain, for example, self-care is the recommended treatment. Patients who are better informed and more educated possess greater motivation for self-care. Individuals conduct self-care and experts and professionals support self-care to enable individuals to undertake enhanced self-care. The recognition and evaluation of symptoms is a key aspect of self-care. The main issues involved with self-care and the onset of illness are medically related, such managing drug side effects, emotions and psychological issues, changes to lifestyle and knowledge acquisition to assist in decision-making. Self-care support is crucial, enabling value and considerable scope in developing countries with an already overburdened healthcare system. But it also has an essential role to play in affluent countries where people are becoming more conscious about their health and want to have a greater role in taking care of themselves. To enable people to do enhanced self-care, they can be supported in various ways and by different service providers. Support self-care support can include the following: self-care information on health and human body systems, lifestyle and healthy eating. Support to capture, manage, interpret, and report observations of daily living, the tracking of trends, and the use of the resulting information as clues for self-care action and decision-making. Information prescriptions, providing personalized information and instructions to enable an individual to self-care and take control of their health. Self-care and self-monitoring devices and assistive technology, self-care skills and life skills training programs and courses for people, aid from spiritual caregivers, advice from licensed counselors, clinical social workers, psychotherapists, pharmacists, physiotherapists and complementary therapists. Self-care support networks which can be face-to-face or virtual, and made up of peers or people who want to provide support to others or receive support and information from others. Being attuned to one's spirituality. Approaches. Self-care practices are shaped by what are seen as the proper lifestyle choices of local communities. Health-related self-care topics include general fitness training and physical exercise, healthy diet, meals, diet foods and fasting, smoking cessation and avoiding alcohol abuse, personal hygiene, life extension, pain management, stress management, alternative medicine such as homeopathy and home remedies, self-help and personal development, self-care portals and the use of health apps. A lack of self-care in terms of personal health, hygiene and living conditions is referred to as self-neglect. The use of caregivers and personal care assistance may be needed. An aging population is seeking greater self-care knowledge primarily within families' connections and with responsibility usually belonging to the mother. Philosophy. Michel Foucault understood the art of living and the care of self to be central to philosophy. The third volume of his 3-volume study The History of Sexuality is dedicated to this notion. For Foucault, the notion of care of self of ancient Greek and Roman philosophy comprises an attitude towards the self, others and the world, as well as a certain form of attention. For Foucault, the pursuit of the care for one's own well-being also comprises self-knowledge. The self-care deficit nursing theory was developed by Dorothea Oram between 1959 and 2001. The positively viewed theory explores the use of professional care and an orientation towards resources. Under Oram's model, self-care has limits when its possibilities have been exhausted, therefore making professional care legitimate. These deficits in self-care are seen as shaping the best role a nurse may provide. There are two phases in Oram's self-care: the investigative and decision-making phase and the production phase. Culture of health. In 1968, Victor Schkuman proposed the term a Eurocubed culture of health or Eurocubed, which has become widespread. The main task of a culture of health is to implement innovative health programs that support a holistic approach to physical, mental and spiritual well-being. In 1994, he was elected to the post of the president-founder of the World Organization of Culture of Health, a Euro-international social movement to health via culture. The organization operates in accordance with the registered and Ministry of Justice of the Russian Federation Charter. Key element of a culture of health is implement innovative health programs that support a holistic approach to physical, mental and spiritual well-being both inside and outside the workplace. In 1995, Schkuman became the first editor-in-chief of the Journal to Health via Culture. This journal of the World Organization of Culture of Health received an international standard serial number 0204-3440. The organization also has its own publishing house, who has the right to publish the books with the international standard book number. Key element of a culture of health is implement innovative health programs that support a holistic approach to physical, mental and spiritual well-being both inside and outside the workplace. The culture of health means recognizing health or Euro-unregistered trademark's central importance in their lives. The essence of the teachings of the culture of health, reveals Professor N. Gribok. He wrote a 2009. Russian Professor Schkuman insists on the fact that the culture of health should be considered as an integral part of the spiritual culture and their moral culture, culture of labor and culture of recreation, culture of personality and culture of relationships. According to the scientist, the culture of health is not only the mechanical connection of the two concepts the concept of a Eurocubed criteria Eurocubed and the concept of a Eurocubed health the Eurocubed. This is their synthesis, which forms a new quality, a new content. Schkuman examines the culture of health as the specific science, that develops the theoretical and practical tasks of harmonious development of the spiritual, mental, and physical human force, forming of optimum environment, which provides a higher level of creativity of life. Thus, Schkuman argues that the culture of health is a separate science, that creates new content. The main challenge of culture of health is the development of spiritual, mental and physical capabilities of man. In a diverse country, Cultural competency in medical practice and health policy has a growing and urgent role in reforming a healthcare system that serves us all. A culture of health is spreading in America. Many states are beginning to make cultural competency a mandatory part of medical training and continuing education for health professionals. At least 5 states including California, New Jersey, New Mexico, Washington, and Ohio have now enacted laws that require medical schools and licensing bodies to provide coursework in cultural competency training. According to a recent study by the Pew Internet and American Life Project, 80% of U.S. web users search for health information online to help them make better health choices. Nearly 25 million Americans have access to cable video on demand through their local digital cable provider. A Gallup poll found that for consumers, television still remains one of the most popular sources for health and medical news. Multimedia program The Culture of Health will successfully harnesses the power of TV, internet and wireless cell phone technology to deliver the latest health information directly to viewers. See also: Americans with Disabilities Act of 1990, Major Life Activities, Executive Functioning, Integrative Medicine, Victor Shkumin. References. Further reading: The Relaxation Response. External links: Self-Care as Health Maintenance, Self-Care in England, Self-Care in the UK, Expert Patients Programme in England, Self-Care in Australia, Learning a New Way of Living, Self-Care in Belarus.